another HealthServes video demonstration and proof of concept. HealthServe can be used for both community pharmacy and hospital management of patient clinical information, but in this particular demonstration, our focus will be on community pharmacy. In this software, for a new patient, you can use this add patient function to create a new folder for your patient so they can manage their clinical information in your practice. But for those who are returning patients, all you need to do is to click on Attend to Patient function, and then I have various options to retrieve their folder. You can use fingerprint to do that. You can use existing OTP. You can use SMS OTP. You can use credential. But for the purpose of this particular demo, we'll be looking at how you can use phone number to retrieve patient folder. And to do that, we click on Get Started. And when we click on that, we input the patient phone number, which of course we must have inputted that at the point of registration. So once we put in the phone number that the patient gave to us at the point of registration and the password we have given to that account, we are good to go. We click verify. Instantly, the system will retrieve that patient folder for us, and that has just been done. And that's what we're seeing now is the patient folder. You can review the patient folder, and also while in the patient folder, there's what we call the dependent patients, like children less than 18 years. You can actually have the account managed by the primary patient, and that is what we're seeing here. And this account we have in this section are accounts for children who are dependent on this primary patient. So you can edit them by going through here. Then you have to look at the patient's existing medical information, what has been inputted into the system by the previous clinician that are work in this patient folder, and that is what we're seeing here. When you are done with this, the next thing is for you to capture the patient information, and to do that, you click on Create New Record, and the system will give you the interface to input all the needed information. We have prescription, we have billing, we have Masco Care tool, and Masco Care tool is further broken down into subjective data, objective data, point of care assessment, medication indication, like what is the drugs you're dispensing meant for, drug therapy problem, Masco Care plan, interventions and recommendations, pathology and counseling, referral to an appointment, as you can use this to book when next the patient is going to come back, possibly for drug refill or follow-up management, or whatever the case may be. Now, when you're done using this tool, you just have to click on Save Documentation, that is this button, and the system will save every information you have imputed into the system. Now, after that, if when the patient has gone, you can always follow up on the patient by checking on them using their communication page, and these are all the patients I have seen. So for me to talk to them, I need to click on their folder, and the system will open the communication interface, which features live chat, voice call and video call. I can engage with them in real time, and then I can also review their folder, whatever I documented for them, by coming to this section. Once I click on their image, which is more like their file actually we're looking at. When I click on their file, the system will open their file, and I will look at all that I have done for them, and I will make necessary review, and if there is need for me to follow up on them, I can do so using patient follow-up system. There's also billing, and there's communication, and also telehealth, which will give you room to consult patients from far and near. This is basically what HealthServes is all about. But in the coming weeks, you'll be expecting more tools on that patient documentation page, where you can have automated drug labeling. You're going to have a system review, which will enable you to review every single organ in the body. And you're also going to have automated drug reminder for patients and so much more. So keep um, keep using HealthServe and will not disappoint you. Thanks for watching.